let me just introduce myself. I'm Dr. Vivek Joshi, and I'm presently working in US as Associate Professor of Biochemistry and Genetics. I did my MBBS in JNMC Belgaum. If you have heard, it was initially called as Jawaharlal Nehru Medical College, and now it's part of KLESH. And then I did my MD in clinical biochemistry from KMC Manipal. That's part of your MAHE in Karnataka. So both my MBBS and MD was done in Karnataka. And then I started working at the Manipal University. I was initially working at the offshore med school in Manipal, which is called as Triple MC, Malacca Manipal Medical College, which is a twinning program between India and Malaysia. So I worked there for a year, and then once I was working, I then moved to Caribbean. I worked in Caribbean Med School for 8 years, and then now I'm working in US in the osteopathic med school here in US, which is called as Kentucky College of Osteopathic Medicine. And I've been working here for the last 2.5 years. And the subjects that I teach is going to be clinical biochemistry, genetics, molecular biology. And because of my background, I help in the clinical medicine courses as well. They have something called as capstone. I'm not sure if everyone in India knows what capstone is, but it's more like where you give them training, but it's all hands-on. We have different names for capstone in India, but in US, if you're in undergrad, if you're in any grad college, they tend to have capstone courses where the students will do self-study and they come up with the answers. All you have to do is guide them or facilitate them. So these are the different subjects that I'm involved in. But over the years, while teaching in different med schools in India, in Caribbean, and here, I've also taught physiology. I've taught. So topics that we're going to discuss today are these, that is the importance of general medicine and so on. That I don't want to bore you going over the topic, but I'll quickly transition from this topic to the important one. What exactly is the importance of general medicine in MBBS? Staying out and seeing different courses. One thing I have seen is internal medicine tends to be various importance of general medicine in terms of the MBBS. Remember, it acts as a foundation for you to understand and integrate all the subjects. You may not realize it now, or you may not realize it when you're in the first year or the second year in the med school. But once you start taking the lectures of internal medicine, if you have enough time or if you read the good textbook, they will build you from anatomy to physiology to biochemistry to pathology to pharmacology and integrate all those basic science subjects into one and then deliver it as internal medicine. The main thing that you're going to look for in terms of the MBBS, in terms of medical in general medicine, is to understand the basic medical condition. Remember, once you become MBBS doctor, you pretty much can practice in India, but then there are different layers of education that you can build on. Right now we have MD, which is basic necessity, and once you are MD, then there are the options of DM and MCH. So the DM will be the medical part of the medicine, and the MCH will be the surgical part of the medicine. It just will branch out, but everything that you end up doing, if you are on the medical part of the medicine, then it's going to be built on this general medicine. And when it comes to outside in US or in any part of the world, when you look for job opportunities, once you're done with the MBBS, the first thing that they will always require, or the major demand for the physicians abroad, is always going to be the general physician, which is nothing but internal medicine or family practice, which are similar. So I would say that general medicine is one of the most important subjects. Even in the exams, you can see when you start taking exams, the competitive exams, be it USMLE, step 1 or step 2, will have many clinical vignettes which will be derived from general medicine. Though the objectives of general medicine may not be used directly in the step 1, but the whole idea that how exactly you can decipher the information for the clinical vignette and then answer the question will be based on your information about general medicine. So I would say that this is one of the most important subjects that we read. When you are in med school, you will see that there's excessive emphasis on the general medicine. I can tell you one thing, I've done it in India. The education I'm teaching right now outside, there's not much difference. We all start with the medical courses, the general medicine in terms from the first or the second year, depending on which school in India you are going to, or if you are in US, your education in terms of general medicine will start from the first week itself. So there's heavy impetus, there's a large importance given to this particular subject in the entire world. So I would say that this is one of the most important subjects that you should focus on, you should know, because once you know this, in essence, you know all the basic the basic medical science subjects. That could be your biochemistry, anatomy, histology, physiology, pharmacology, pathology, microbiology, or immunology. So everything will be encompassed into one particular subject, that is general medicine. So in short, medicine is nothing but general medicine. Okay. Right. So coming to competencies, right? When we initially started off, till I guess till 2019, none of these schools in India were following competency. But when you look at the education system in US, the competency started back in early 2000s, where many what we have here is slightly different to what you may see in India. In India, you have MCI, which is the Medical Council of India, which oversees each and every state's medical council, and they come up with the policy that every state has to follow. But it's not similar in US. There are few states who have their own rules and regulation. You need to give the exam for each state when you move from one state to another state. So many states came together and they came up with this whole idea of competency, because just grades do not satisfy if a person is competent in terms of being a physician. So ACGME, which is the regulatory body in terms of the council which runs the education of medicine in US, they came up with 6 basic competency that each and every physician who gets that degree of MD has to satisfy. And they came up with a rule that by 2023, every school, if you want to apply for the USMLE, you should have the competency on your transcript. And India was lacking. And I guess that was the reason why MCI announced in 2019 that you have to mandatorily have the competency. I'm not sure how many of you know which are those competency, but I can tell you there's something called as medical knowledge, there's something called as patient care, you have lifelong learning, problem-based lifelong learning, you have something called as system-based practice and problem-based practice. So these are some of the and cultural competencies, and these are some of the competencies that you have to fulfill, and it is absolutely mandatory. I see here they start with having to assess the competency right from the first day itself, and it builds on. And when their transcript come out, they exactly know which competency they have satisfied in and which they have not. If you have some unsatisfactory competency, then the school will work on it and try to remediate it and get your competency to the level where you should be able to apply for the residencies. So I guess this idea of getting the competency in Indian school is a good way to go forward, because there's less impetus on your grades and more impetus on what you have learned. Just getting good grades does not mean you are going to be a good physician. It is correlated, but you will also see that the clinical exposure and the clinical knowledge is different from how much you get on the exams. Predominantly, the exams in India have historically been where you write long answers, uh, and you can go on writing. If you're a good writer, then you can write a lot, and that correlates well with how much you end up getting. But now we have moved on, we have gone into evidence-based medicine, and you have to exactly know, you can't retain everything that you learn, for sure. So your knowledge and your information has to be focused onto those things that you're going to retain for a long term. And competency in one way or the other helps you in attaining those important concepts that you're going to retain for a longer time. And I feel that it's a good way forward that India is going into competency-based UG curriculum. I guess many schools have already adapted it. I know for sure we have FAMER in India, which is the medical education pioneers, and I see CMC Ludhiana or Manipal University who run these courses, or KEM in Mumbai, which are primary universities which are taking part in these FAMER run initiatives, which in turn tells the LCME in US what policies they should be bringing forward, which in turn will tell ACGME to come up with the new policies for the students. So it's all linked. It's not unrelated. So I feel that if it's happening in India, it's late, but not that late that you will miss the bus. But it's a good way going forward. Okay? And competency will make sure that it's not just didactic lectures that the schools are delivering. They'll force the faculty to come up with innovative learning. And when you're working in innovative learning environment, your learning is much more. We all have been through lectures where after 15-20 minutes you lose concentration. You don't realize what's happening. Very few of us may sit through 40-50 minutes and take down each and every important point of the notes the faculty is going to say. But many a times you'll see many of your friends after 10-15-20 minutes into the lecture, they just lose the interest. So this competency is extremely important. What I will say is, see, when you're choosing your med school, see if they are offering a competency based course, which is really important if you want to apply for the USMLE, because it is going to be required. They do look for, especially in terms of when you apply for the residency. If you do the MBBS outside US, you will be applying for the residencies, and with the way the things are changing, with the way the step one scores are going to be taken out, and then it's going to be replaced by pass or fail. So you will need these competencies which will correlate well with your application. If you have unsatisfactory or if it's missing, then you may be lost in the race when they bring up the list for the residency spots, because you may not be having the competency satisfaction on your transcript. It may put you lower down in your order. Okay, right. Let's go on. Now coming to some of, do you guys have any questions in terms of competency, or what you expect in terms of medicine? In general, why medicine is important? One thing I will tell you for sure is, the moment you enter a med school and you're done one year or 2 years in med school, people around you will feel that you pretty much are a doctor, and they will ask you for advice or diagnosis. It will happen when you're traveling in auto rickshaw or in taxi, and if they know you're a med student, they will surely reach out to you and ask you. And that's where the medicine part, the internal medicine, comes in handy. If you've started studying medicine, and I'm sure most of you will have your first rotation within the first year or by the beginning of the second year for sure. It depends on which school you're going and what the curriculum is going to be. I had my first clinical experience after the first year, but then it's so many rotations one after the other that you grasp the information. So by the time you're done with the second year, you pretty much know the basic conditions that you will come across, not maybe intricate details about each and every rare disorder or some hard topics, but overall the basic diseases. You will always know what to do with the common cold, what to treat for diarrhea or respiratory infections. You may not know what happens in COVID, but the rest you may always know, the basic infections or the basic diseases that the people suffer with, be it diabetes, be it hypertension. So these are some of the concepts which will be reinforced in internal medicine. If you become medicine internal med doctor, remember one thing: outside you have two different courses. One is internal med and family practice. They both are the same. Family practice is more outpatient. Internal medicine is more inpatient. That's the only difference, but it's the same patient core that you are going to cater to. It's the same topics and same way you're going to study. It's just one is inpatient, the other one is outpatient. Okay. So any questions regarding the competency, or how exactly we assess the competency and how it shows up on the concept, or on the transcript, or what if you want to know further about the competency, please send me questions and I'll try to answer those. Right, going on, I don't see any question coming in. So going on to the next one, famous author books for the subject. It depends on which level you are and what you're studying for. Okay, I see a question coming. So just a second. So I am asked difficulty level of general medicine. It's not too difficult, as I told you. When you read physiology, when you read pathology, when you read pharmacology, when you read biochemistry, when you read anatomy, you're reading them separately. When you bring them together, that's what the general medicine is going to be. So when you get to general medicine, when you start reading general medicine, then by that time you have pretty much finished reading all these basic science subjects. So it becomes very easy. Uh, One of the easiest subjects when you get into clinical is going to be internal medicine, because you have studied all the other subjects so much in detail that this one is just a cherry on the cake, where all you're trying to do is integrate different courses into one and think like a physician. So I would say that it's not too difficult unless you get into the difficult topics in terms of difficult diseases. If you're in the simple diseases, if 70 to 80% of the of the concepts in general medicine is going to be very simple, straightforward, if your basic foundation is strong. But it's only 10-15% of the topics which are rarely are relatively new or rare, which you have not studied in any other course. But if they show up, then it might be a bit difficult. But in general, I would like to say that general medicine level is not too high in terms of the gaining the information, but the importance wise, it is the highest that you can think of. Once you know general medicine, you know most of it. That's why I said once you know general medicine, you are as good as a physician, because you know most of the stuff, except the surgical part, which again is a completely different path. But if you are looking at the medical side of it, medicine is the epitome of all the subjects, and it's made by combining each and every basic science subject. So once you know the foundation, general medicine is extremely easy. Okay. Right. I hope that answers your question. Going on to the books, the Bible that we call for medicine or for any medical student is going to be Harrison's Principle of Internal Medicine. There is no topic in this book that is not covered. Anything on the earth that anyone knows of will all be covered, and it's covered in detail. It's a set of two books. If anyone is able to read this book, it's going to take a lot of time. The first part, it gives you the basic physiological and basic pathology, or the basic topics, and then it goes into the systemic explanation of different topics in the second part. The number of pages keep on varying every year because they edit, but I would say Harrison's Principle of Internal Medicine is one of the most important books that every student should have. There are three different forms of it. You have the big one, then you have the small, and then you have the pocket version. Pocket version is the high yield. Anytime you are going on clinical rotation, I suggest have the pocket version, because anytime you want to just quickly review or refresh your information, that book comes in handy. Even when you're reading for the exam, if you have Harrison's pocket version book, then one night or two nights before your exam, you can quickly read through the important points, so that you will be able to answer the questions when they are asked, because every faculty tends to ask you the high yield questions. They will not ask you the topics or concepts which are not that important, or based on the memory, unless that's what they want to test. But if they really want to test your concept, then the pockets version of Harrison's Principle will come in handy. But if you're able to read the textbook, which is going to take a long time, I suggest that very few try to attempt. But over the time, if you get into medicine, then you pretty much will read Harrison's Principle of Internal Medicine, because it's called as the Bible in med school. Apart from that, you can also read the smaller books, because we have 1 year for medicine, or we have 2 years for medicine, because you start from the third year, where it builds on third and fourth year. So you can always read the other two books, which is going to be your Kumar and Clark or Davidson's Principle. This is more written in terms of a British language, and Davidson's is written more in terms of the US language. So that's the only difference. But both of these books are the smaller version of Harrison's. When you read these books, you would realize that they have taken the concept from the Harrison's principle and put it in their own words. So in short, these are the minor versions of Harrison's principle. Kumar and Clark comes more close to Harrison's than Davidson's because it's slightly different, but you can always read any of these books. And if you want to go much easier, you just want to prepare for the exam, then Prep Manual for Undergraduates by George Matthews. This is one of the other Bible that every med student will read. If when you get into biochemistry, let me tell you, you have different books. You have Lippincott's, you have Harper's, and then you have Satyanarayana. It is that one book will give you concept, the other book will help you how to write the answers, right, for the questions. That's what is the most important point, because not just entering and getting concept, but passing your exam and clearing your exam is important as well. And this book, that is George Matthews, is one of those best books which will help you write the answers in a way it should be written. It gives you a nice flow as to this. If this topic is asked or any question regarding this topic is asked, then this is the flow that you follow. And once you read that book, you pretty much can follow the same route to each and every subject and write it in a certain format, because the way you represent the answer is also important, not just the concept, because some faculty may, I'm talking about the long and short answers. I'm not talking about the MCQs, because there it's just the question and answer. But if you want to write an answer for a long question or a short answer, then you need to have a flow to your answer sheet or the way you answer. And this book, that is George Matthews, will help you get that concept properly. So I suggest that keep this book handy. I'm sure when you get into the med school, your seniors or your peers will tell you that this is the book that you should be following, because the faculty will always say Kumar and Clark, Davidson's or Harrison's, but in terms of the students, it's going to be George Matthews, which will help you write the answer correctly. And this is all about the knowledge part. When it comes to the clinical skills, which is again one of the important competency that the US education or the Indian education looks for, it's going to be your clinical skills. And there are few books for the clinical skills. When I was there, we followed Hutchinson's clinical method, and some students followed McLeod's. So you can either follow both. You can follow either Hutchinson's clinical methods or the McLeod's, or now the latest book is Physical Diagnosis, a textbook of symptoms and physical science by Rustam Jal and Vakil, which is again one of the important books. Most of the US students tend to read this physical diagnosis, which will help you in clinical skills, where you are given a set of signs and symptoms and what are the diagnosis and the differential diagnosis in detail. So this book really helps in that aspect. So having 2 or 3 books for each subject is going to be required for you, especially the clinical subject, because you'll have one for the clinical skills and 1 or 2 for the clinical knowledge or medical knowledge. So for medical knowledge, the top 4 that you see, Harrison's, Kumar, Clark, Davidson's, and George Matthews, these are going to provide you the medical knowledge part in terms of theoretical or concept. And for the clinical skills, you can either go for Hutchinson's or physical diagnosis, but there are few more. Yeah, as I said, if you don't like Hutchinson's, the way it's written, because it's going to be subjective when you read and when you want to translate it onto a patient on examination. Some may like Hutchinson's, others may like McLeod's. Some systems are good in Hutchinson, some are good in the other book that is called as McLeod's. So you may just shuffle between these 2 books, but nevertheless you can always follow one, right? Or you can always go for physical diagnosis, right? So these are some of the books. So I would suggest that have 1 or 2 for your medical knowledge and at least 1 for your clinical skills, and that you're going to follow all your life. If you get into the medical practice, then you will require it. You may not require it to keep reading, but it will always come in handy. suddenly you want to go back and refer to one important test that you want to perform when there is no investigation or diagnostic equipment available. So these books come in handy, so that it gives you a hands-on approach, the bedside test that you can always do to get to diagnosis quickly. Okay, so I would suggest that these are the list of books, but we can add many more. There's new books written every day by different faculty, and if you feel that I like this particular book more, the language or the style of it, then you can use that. But these are the ones which are generally used. I know for sure most of the med students use this one for preparing for the exam, and these books for preparing for the concept in medical knowledge, and these two books for your clinical skills. Right? Any questions on these aspects? Okay, I get this question as any difference between general medicine taught in India and in other country? No. The only thing I can tell you is the way it's delivered and when it's delivered. I know for sure in India, when I was learning and I was working, the medicine did not start till the second year. The first year was all anatomy, biochemistry, and physiology. You were reading it for the 1 year. Before I started was 1.5 years. So it wasn't till the second year where we started to go to clinical rotation. I believe it's similar right now. But in US, you start with the clinical education from the first week of the med school itself. Because in the first semester itself, we will have different courses. It varies. In some schools, it may be anatomy, biochemistry, and then you may have clinical subjects because it's unlike in India where it's a year, it's more like a semester here. You do a semester, you pass a semester, then you go ahead. If you don't pass all the subjects in that particular semester, then you either are dismissed or you're made to repeat, or depending on which subjects you fail, you may either go ahead or you may be held back. But irrespective of it, you will start with the clinical education from the first day itself. That's one difference between what we have in US and what is present in India, because all 4 years you will be in the same campus. You do not go anywhere else. If it's a med school, if it's a medical college in India, it has a hospital associated. So you go, you stay there, your lectures are in the medical college, and then you go for the clinical rotation to the hospital. But in US, the system is different. You have the basic science and the clinical science. For the basic science, you are in the medical school, but when it comes to the clinical science, that is after your first 2 years, between the 2 years of the first, or rather first 2 years, after the first 2 years, you write your SMLE, you clear your USMLE step one, and then you go on to clinical courses. If you don't pass your USMLE step one, then you will never progress to the clinical courses. So the pass rate for USMLE is going to be 100% in US, and hence so I just meant because I was looking at a question. So it just that's the basic difference when you start. The clinical skill, the patient exposure is slightly delayed in India compared to US. It's from the first day itself. So by the time they get the clinical rotation, they know everything. And when it comes to the Indian system, you will learn everything in the clinical rotation. You will start learning with the examination. So that's done in the first year here. It's done in the second year there. So that's the only difference. But you guys make it up by doing the internship, which is not done in US at all. So their med school is only 4 years, and then they get into residency. So in 7 years, they're pretty much the doctors in terms of the general physician. But in India, it's going to be 5 years or 5.5 years, depending on when the school starts and when you finish with all the exams and everything. So that's the major difference when you start off. But what you learn, how you are assessed, is not different. It may be assessed in greater detail in India. It's much more tougher in India compared to what you have here in US, because it's all objective. You are given a rubric and you just follow that rubric. In India, it's much more hard. Okay, right. And I had the next question in terms of which book is better. Harrison is the best book that you can think of, but the other book is the Kumar and Clark's or Davidson's. I would personally prefer Kumar and Clark because it has an easy flow to the language, and it is much more closer to Harrison than Davidson's. So I personally like Kumar and Clark, and you will, when you speak to different people, different students, they will all prefer Kumar and Clark. The first one to come was Davidson, so people went for Davidson, but now I think everyone's going for Kumar and Clark, right? Right. I don't see any other question coming. So going to the next one, benefits of Moksh online sessions. So as you can see, when you go through the list of the faculty, we have some of the best faculty teaching the first year. It's not just from India, it's from the different countries. So you have a wide range of exposure, you have the wide range of experience, you have the wide range of the teaching methodologies. So all these are going to be extremely different, and it's going to be exciting. And you have the live online coaching. You can always ask us questions whenever you want, and we are always there to ask you. I get one more question. Did I face any challenge during journey? No, I did not. The only thing that you might struggle is time management. So if you start studying from the day one of your medical college or medical journey, then you will never struggle. At least study 1 or 1.5, 2 hours every day. Try to get done with what was taught that day. So your exams will be smooth. Your transition from first to second year to third year to fourth year will always be smooth. So is going to be your step 1 and step 2 preparation. If you are prepared well during your first 2 years, when you join our courses, it will be very easy for you. You will get the concepts properly, you retain the concepts, and we will try to help you guide and try to remember those important concepts for the board exam. So it will be easier for you if you start off from the day one. I'm sure no one will start from the day one, but at least as soon as you start your med school journey, try to get the study rolling sooner, so that you're on top rather than you're stuck at the bottom. Okay. And coming to the other parts is we have the LMS, which is based on artificial intelligence. So it never gives you much trouble in terms of technology, but the internet might create some trouble, but it's one of the smooth transition. I always take lectures on go to webinar, and it's always helpful, right? And we have a solid team which will help you analyze your exam and come up with a report and tell you where you need to work on and how you need to work on, or work with you to come up with a plan. You can always reach out to us and ask in detail how exactly or where exactly you need help. So we are all there. So do not hesitate to reach out or ask questions during the sessions or after the sessions. It's just that the more you reach out, the more help we can provide. And there's always doubt solving supports. You have a big team working behind. Even right now, there's a team working behind this webinar who are trying to work it out smoothly. We may have hiccups, but they're all there working to help you guys, right? And my teaching methodology, it's quite simple. When you sit in my lectures, you will see when I take lectures right now, I have a lecture right after this webinar. I try to bring in as much clinical. These students that I teach are in their first semester. They're just 3 or 4 months into their medical education journey, and they know so many diseases because every pathway, when you start off in biochemistry, you may expect it to be volatile, you may expect it to be superficial or unimportant, but if the professor can integrate the clinical conditions in your biochemistry and make it interesting, then the students are going to like. And now we get these reports, we get the feedback from the students where they particularly like our subject because we make the subject so interesting by giving them questions in the class where they have to think and they have to answer it. It's all going to be the interactive audio video where they may have to use some software where they click the answer and I get the real-time answer and I can see who is answering where and work on it. So that's what I try to do. I try to interest the students in terms of lifelong learning. I try to give them tough questions on the exam where they have to sit down, scratch their head. I use multiple resources because I have some sessions where I call it as TBL, that is team-based learning, where the answer is not straightforward. I'll give you a clinical vignette which takes you all around. It's like a maze, and hence the student have to really dig deep to come up with the answer. So that keeps their interest alive, and they want to go back and read and try to answer, because I try to make it as a competition, and everyone wants to win that competition. The other thing that I want the students to do is understand the concept that they can apply. So all, as I told you, all my lectures, all my topics that I discuss with the students are completely clinically hard core. So they will understand that this is what is required going forward if you become a general physician. So that's what I try to do. And what I try to tell them is, frequently I tell them read, because medicine is not more about intelligence, but it's more about hard work. Intelligence can take you far, but hard work will take you completely ahead of everyone. So for that, you have to keep on reading, and if you read more, it's going to retain in your memory for a longer time. So these are my three overall philosophy that I have followed, and that's what I try to tell students. And work out as many questions as possible. If you work on multiple questions in the first 2 years, then you are going to get very high score on step one or NEET exam. And coming to the weightage of the subject in NEET or USMLE, remember it varies year to year. It will vary depending on the USMLE, because it's all computerized. We feed the questions in the database, and then suddenly they run the algorithm and you get the exam. So it tends to vary, but in step one, the concept of the general medicine will be close to 15 to 20%, or you can say close to 30%, where every question will start with clinical vignette, and when you have clinical vignette, that means it's general medicine. So I'm being very less generous and given it 15 to 20%, but if I can go ahead, I can tell you it's close to 50 to 60% in terms of the general medicine influence. But in terms of hardcore general medicine, it's going to be 15 to 20%. The way the questions are asked is in terms of general medicine, but they'll test your basic science foundation. So that's the reason why I've given you 15 to 20%. But if you look at the question, you will see that, oh my God, every question is clinical vignette. So it's going to be close to 100%. And on step two, it's much higher, where they really want to test your general medicine. So general medicine, pediatrics, internal medicine, they all will have, or family practice, they all will have the same questions. So it tends to be close to 30 to 50% or more than 50% sometimes. And then you have the OBGYN, you have the surgery, and you have the skin and other conditions which will take up the rest of the question. But I'll say more than 50% will be on step two. So it's very important for both step one and step two. The way the questions are asked may be different in both, but it's still relatively important. Okay. And the next one is these. When I was writing the exam for the PG, it was close to 40 to 60%. And we all know internal medicine is the most important. That's when I read my Harrison. That's when I read Harrison for my exam. So I know medicine is the most important topic in you cannot get anywhere close to any PG if you don't read internal medicine. The rest are important, but to a minor extent. You can go as high as 70% in NEET for the internal medicine. Important topics in medicine subject, right? Which one are you asking, in terms of the exam or in terms of the practice? If you can be more elaborate. For practice, it's different, and for examination, then I can tell you which topics you need to really focus on.